Good afternoon, Magnus Miller. Let's begin the warm-up session. What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It is always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult, but also rewarding.
How do you deal with someone who isn't satisfied with your patient care?
When faced with a dissatisfied patient, I assess the issue, determine if it's something within my control to correct, address their concerns, answer their questions, and collaborate with colleagues for alternative solutions if necessary. My goal is to accommodate the patient without compromising their care.
Tell me what you feel your greatest skill as a nurse is.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can help make someone comfortable. In addition, I learned that addressing their concerns and communicating assuredly make them feel comfortable, which is important to receiving quality care.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want to help, and when I can't, that's hard.
How do you handle the stress of the job?
To handle the stress of the job, I prioritize self-care and seek support from colleagues and loved ones. I maintain a healthy work-life balance by scheduling regular breaks, engaging in activities I enjoy outside of work, and practicing stress relief techniques such as mindfulness or exercise. Additionally, I make sure to communicate openly with my colleagues about any challenges I'm facing and seek their advice and support when needed. Taking time to decompress and recharge allows me to approach my work with renewed energy and focus, ultimately ensuring that I can continue to provide the best possible care to my patients.
Your preparation time is over. You can now start your roleplay.
Good afternoon. My name is Magnus Miller, one of the nurses here in the Community Health Center. What brings you to the clinic today?
Good afternoon, Nurse Miller, thank you. It's these cramps, you see, in my calves. They just wake me up almost every night now. It's really quite painful when it happens.
Oh, I'm truly sorry to hear that your sleep has been disrupted. It sounds quite frustrating. Before we proceed, may I know your name, please?
My name is Mihiraa.
Mihiraa, my aim today is to understand what's been going on with you, particularly concerning your sleep, and then discuss some strategies that might help you get a more restful night. To get a clearer picture of what's happening, could you describe these cramps in a bit more detail for me, Mihiraa?
Well, they used to be occasional, but now it feels like almost every night, sometimes even 2 or 3 times a night. It's usually in the early hours of the morning, around 2 or 3 a.m. The pain is quite sharp, I'd say about an 8 out of 10 on a pain scale, and it can last for a good minute or two, sometimes even longer before it starts to ease. It definitely makes me wide awake, and then it's hard to get back to sleep. My husband gets woken up by me moving around or groaning, and then we both end up tired the next day. It's really affecting my energy levels, and I'm finding it harder to enjoy my active lifestyle as much as I used to.
Thank you for providing such a clear description, Mihiraa. That gives me a much better understanding. I understand, calf cramps can certainly be very disruptive. Now, to help me understand your overall health, could you tell me a bit about your general health?
I'm not on any regular medications, just an occasional painkiller for a headache if I get one. I try to drink plenty of water, probably around 2 liters a day. As for exercise, I love to stay active. I play golf 3 times a week, go for a brisk walk most mornings, and enjoy gardening, which involves a fair bit of bending and lifting. Though my diet is generally quite healthy, lots of fruits and vegetables, lean protein, and whole grains, I worry that I may have vitamin or mineral deficiencies.
That's excellent that you maintain such an active and healthy lifestyle, Mihiraa. Many people worry about vitamin or mineral deficiencies being the cause of cramps, and while it's a common thought, it's actually not a frequent cause in generally healthy individuals like yourself. There are, however, several more common explanations for muscle cramps, especially in someone as active as you are. For instance, sometimes excessive exercise or a new, more intense physical activity can lead to muscle injury or fatigue. Also, as we get a little older, there are natural age-related muscle changes that can make us more prone to cramps. Additionally, poor circulation can sometimes contribute to these issues.
So, what can be done to manage this?
So, based on what you've described, there are several things we can try to manage these cramps when they occur and also to prevent them. For immediate relief when a cramp strikes, you could try applying an ice pack to the affected calf, gently stretching the muscle, or even giving the calf a massage. Mihiraa, to help prevent them from occurring in the first place, I'd recommend doing some gentle stretching exercises for your calves before you go to bed. Taking a warm bath before sleep can also help relax your muscles. Maintaining good hydration throughout the day is crucial, so continue to drink plenty of fluids. And finally, try to avoid overexertion during your activities, especially if you're starting a new or more intense exercise. Do you have any concerns about these strategies or any questions about what we've discussed so far?
No, that all makes sense actually. I hadn't thought about how my exercise might be contributing to it, especially as I've been trying to increase my golf rounds recently. The stretches and warm baths sound good.
That's great to hear, Mihiraa. To further help you, I would strongly encourage you to consider seeing a physiotherapist. They can provide you with a personalized exercise program and specific stretching guidance tailored to your needs, which could be incredibly beneficial in preventing these cramps. They can assess your muscle strength and flexibility and show you the most effective stretches. Additionally, if your symptoms continue or worsen despite trying these strategies, it's very important that you return for a follow-up review with us. This way, we can reevaluate your situation and consider if any further investigations are needed. How does that sound to you?
A physiotherapist sounds like a good idea. I'll look into that. And yes, I'll definitely come back if things don't improve. Thank you, Nurse Miller. This has been very helpful.
You're most welcome, Mihiraa. I'm glad we could discuss this today. I hope you start getting some peaceful nights of sleep very soon.